Good morning, how can I assist your family today?
我们担心我爸爸，最近他讲话和理解语言有些困难。
Has there been any recent medical history, like a stroke or head injury?
他3周前中风了。
The difficulty in speech and language comprehension you're describing could be related to aphasia, which often occurs after a stroke.
什么是失语症？但他在医院的时候完全没事，他可以走路、吃饭和说话，好像从来没有中风过一样。
Aphasia is a language disorder that affects a person's ability to communicate. It can impair speaking, understanding speech, reading, and writing. Although it is rare, it is possible to have a stroke and not have any issues right away, but then develop aphasia after a week or so.
失语症不仅仅是说话，理解也会有问题，对吗？
We'll need to assess him further to determine the type of aphasia. We can perform a comprehensive neuropsychological evaluation and a brain imaging test.
我爸爸什么时候可以做这些测试？
We will schedule the speech test as soon as possible, typically within a few days. As for the MRI and CT scan, we can arrange those tests within the next 24 to 48 hours to assess any brain damage. I will put in the order. My nurse will schedule for you when we are done here.
有没有方法可以治疗失语症？
Yes, treatment usually involves speech-language therapy. The goal is to help the person recover their language skills and develop alternative ways to communicate.
恢复需要多久？
Recovery time varies. Some individuals experience significant improvement within the first few months, while others may need ongoing therapy for a longer period.
有没有药物可以帮助失语症？
Currently, there are no medications specifically for aphasia. However, certain medications might be prescribed to manage underlying conditions like depression or anxiety that can occur after a stroke.
失语症会不会自己好转？
There can be some spontaneous recovery, especially within the first 6 months after a stroke. However, structured therapy is often necessary to maximize improvement.
他的情况有可能变得更严重吗？
Aphasia might improve with therapy, but in some cases, it could remain stable or show minimal progress. However, ongoing support and therapy can help maintain or even enhance his ability to communicate.
他的情况有可能变得更严重吗？
Aphasia does not directly affect memory, but if his stroke involved other areas of the brain, memory and cognition could also be impacted. We'll monitor this closely.
他还能做其他活动，比如看书和写字吗？
It depends on the severity of his aphasia. Some people can recover their reading and writing abilities with therapy, while others may need to rely on alternative communication methods.
我已经问完我要问的问题，谢谢医生。